Plans are in place to drive greater COVID-19 vaccine take-up in communities. Prime Minister Andrew Holness says persons will be employed in a mass mobilization effort on the ground to ensure that the public gets access to vaccination sites. That's just one of several strategies being implemented in the government's COVID-19 vaccination program. The Prime Minister shared the plans during a virtual press brief this week. Prime Minister Andrew Holness says 40 persons will be employed temporarily in each of the 63 constituencies to assist in the community vaccination drive. The Prime Minister explained that during a tour of sections of St. Thomas, he heard concerns from several residents, including issues of mobility in accessing the various vaccination sites.
My intention is to present you with the information. But we have met upon more persons who simply just do not know, and that lack of knowledge leads to a lack of action on their part. They just don't know, and they have questions. So we met upon a lady who, for example, said, well, I have a situation and I have to check before, and obviously she had a heart condition and she was uncertain. So my advice to her was, go and talk to your doctor just to be sure. But, if you were to contract the disease with your heart condition, your probability of a fatal event is far higher than if you had the vaccine. Obviously, we are not doctors, so we can't give any medical advice. We're merely presenting the information as documented and packaged by the Ministry of Health.
He also observed and noted issues regarding crowd control at vaccination sites.
I wasn't 100% satisfied with actually visiting the vaccination site, which is quite different from the tour. When we went there, the sites were crowded, people were coming out. And we have seen this right across the country as people turn out to get vaccinated. It is part of the risk, and we will be meeting with the Ministry of Health to have that special discussion about how do we control the sites.
The Prime Minister says, in addition to the ministry's health workers, stakeholders have been contacted to expand the vaccination program.
It is clear that if we're going to meet the vaccination goals, we have to pull in more stakeholders. And it is always very difficult because you have entrenched positions, people have perspectives on how things should be done, people have professional positions on how things should be done, and others have what they consider to be practical positions on how things should be done. And the dynamics and the politics of that is not always easy to navigate. And so, yes, there might have been a little bit of slowness in how we resolve that, but I think we are close to coming to a point now where we would have a very robust, well-thought-out system of expanding and ramping up the vaccination operationalization plan. And so you're going to see outsourcing and contracting of the service, and you will see that commence very soon. An announcement should be made. You will see that go through a procurement process of bringing in private contractors, and that will obviously include members of the private medical profession who would come in and assist.
He also spoke of a private sector industry initiative.
We want to rapidly increase vaccination in the tourism sector. And you can see strategically why you'd want to do that. We would rapidly want to increase vaccination in the BPO sector. These are kind of closed ecosystems that have everything for them to operate. And if they are in a closed ecosystem and they are fully vaccinated, the impact of what you would call, national measures would be less on them because they have reached that level of immunity.
Over 500,000 people have taken the COVID-19 vaccine so far. The program's aim is to have 700,000 Jamaicans vaccinated by the end of September.